Welcome back. We're launching our last session here. It's been a fantastic conference looking at how do we ensure a healthy conception, a healthy pregnancy, a healthy start to life. And it's really that last aspect that we're focusing on in this final session, how to thrive in a changing environment. I'm Gary Darmstadt. I focus on global issues on maternal and child health. Over the course of my career, I've seen a lot of focus on child survival. I've seen a couple child survival revolutions. The first one with Jim Grant that focused on some very specific interventions, vaccinations being one of the main ones. That was in the 80s. More recently, in the 2000s, we really began to focus on key interventions that could drive child survival, began to put more focus on newborn survival. We're realizing now, as we enter out of the Millennium Development Goals into the age of the Sustainable Development Goals, that we need much more focus on how to help children thrive. This is really, I think, the fundamental driving force for the Sustainable Development Goals is to help children thrive and to achieve their full human potential. We've now driven child deaths globally down to below 6 million. But we now know that we have over 200 million children, and this is certainly an underestimate, who are at risk for compromised development. Some of the primary factors due lack of nutrition leading to stunting, aspects of poverty. We have over 1 billion children we now know are maltreated. And we know that these various conditions, these various risk factors have tremendous impacts on children's development. We had some foreshadowing yesterday of some of the impacts that these risk factors can have even on the structure, the architecture of children's brains that can be irreversible. We know that this early period of child development, even beginning in utero, but certainly in the first 2 to 3 years of life, is a fundamental period for shaping brain architecture, for shaping children's personality, their ultimately even their adult productivity. The estimates are that currently the risk to children's development, we're paying a toll of a 30% reduction in income producing potential among children as adults around the world. So the things that we're talking about can have absolutely transformative impact on our world. In this session, we're going to begin to look at some of these aspects that can help optimize the development of children. We certainly know that children need a healthy start. They need good health. They need good nutrition. They need a good learning, stimulating environment. They need social protection and child protection. Kind of overarching across all of that is they fundamentally need nurturing care. They need to be in an environment where they feel secure, where they feel stimulated, where they feel free to explore. And so it's in that context that we turn to our 3 speakers to tell us about some of these fundamental features of being in community, of being in a family, of being in a system that can help support their healthy development. Our first speaker is Dr. Alan Guttmacher. He hardly needs an introduction. Alan is now in Vermont. He looks awful serene when you see him now, having stepped down from NIH. He's at the Permanent Fund for Vermont Children. He was at the NIH for a number of years, since 1999. In fact, he went there to help lead the Human Genome Project and then transitioned to being the director of the NICHD. When I was at the Gates Foundation, I had the profound privilege of working with him on some initiatives, and he's deeply committed to children's well-being in a very integrated and broad way. And Alan is going to speak to us about child care, an overlooked opportunity to improve health and well-being. Alan, thank you very much for joining us.
Thanks very much, Gary. It's a real pleasure to be here. It's always a pleasure to be on any platform with Gary. And when the organizers asked me about coming to give a talk, I thought, well, it's great. I've stepped down from the NIH. First of all, I can actually say what I think now. And second of all, I'm actually involved in some research, and this is a research conference, so I thought, what do I have data that I could actually present? And I did think about 3 different areas, 2 of which I actually have some hard data unpublished, so what's better than presenting the conference unpublished data? The first of those was a case study, only a case study, but I do have data, a case study of reclaiming an ancient apple orchard. Now, I thought it might not fit with the theme of that, so I thought, I also have a recent, unpublished, but very careful analysis comparing the Kubota L series and the Deere Family 3 compact tractors for small farm use. I thought I could present that, but undoubtedly you're sort of familiar with that data already, so I thought that wouldn't make sense. So the third area that I've become involved in Vermont, we don't have data yet, but I still thought was the most compelling to talk with you about, and that is childcare. If you remember nothing, when you give a talk, you're supposed to make 3 points and just make them over. I'm going to make 1 point. It's only 2 words, depending on how you spell. It could be only 1 word. Childcare. So what did he talk about? Childcare. That's the message I want to leave you with, and I'm going to try to really make a case of why I think this is an important thing for we who care about children's well-being to be paying more attention to and doing, I think, some novel things to take a better advantage of the possibilities of childcare than we have historically in the U.S. and almost any place globally, though some of the Scandinavian countries clearly have done a better job than we have with this. So early childhood, of course, we're all interested in. It's a theme of this conference, et cetera. And there have been lots of efforts in the U.S. specifically to improve the lives of children 0 to 5. Most of those have focused on improving parenting skills, or the more recent movement to really establishing pre-K for kids 3 to 5. Vermont, I'm proud to say, is one of the national leaders in that. We now have a statewide mandate for pre-K, only 10 hours a week, unfortunately, but pre-K. And those are very important. However, hiding out there in very plain sight, we talk about it, but we don't think about it very much, is childcare. And the reason why that becomes important is simply, the Willie Sutton hasn't been, it's the first conference in a long time that it gets this late in the conference and no one has mentioned our founding father, Willie Sutton. So Willie Sutton's idea, why did you rob banks? It's because where the money is. Well, why should we care about childcare? It's because that's where the children are. In the U.S., there are almost 11 million kids under the age of 5 who are spending an average of 36 hours a week in childcare. In Vermont, we have very good data, and it's now close to 75% of kids in Vermont, 0 to 5, have both parents working outside the home or in some form of childcare. So that's the first reason why we should care about childcare. That's where the kids are. And if you think about waking hours of the week, it's a substantial proportion of children's lives that are in a childcare setting. Interestingly, there are recent data which were gathered, just published earlier this month, a report from the Economic Policy Institute by the folks you see here. There's the URL for it if you want to look it up, epi.org/101151. And the executive summary of this, they made 3 basic sort of recommendations. The first was that we should do a better job of expanding publicly funded home visits by trained nurses, something that you heard the Maternal and Child Health Bureau is certainly interested in, and others. You heard about that yesterday, the excellent talk. But the next 2 are really both about childcare. The first point they make under childcare is providing resources to ensure that all families can access high-quality childcare. And really the question of access and quality are probably the paramount ones. But then also providing resources to ensure professionalization of early childhood caregivers and teachers to attract and retain, the retention being a very important challenge, well-credentialed staff, and close earning gaps between early childhood workers and other workers with similar skills and credentials. So it's being paid attention to, and of course childcare historically has not been totally ignored. Head Start, for many of us, is a model established by Julie Richmond and others back, now over 50 years ago. that while there have been some concerns about it in various ways, has been a valiant attempt and often very successful in other similar programs, both to raise and to level the playing field. And this is an important issue, I think, as we talk about childcare. It's not just the sort of quality of the best childcare available, it's the quality of all the childcare available, because there does tend to be some segregation within childcare of kids by socioeconomic class. There's clearly been attention in childcare in terms of child development, but that attention has been too often sporadic, has not been evidence-based frequently enough, and we think we can do a better job in terms of cognitive, emotional, and social development being focused on in childcare settings. There are these issues of availability, simply geographic availability, clearly of affordability, and that's an issue for folks in almost from any socioeconomic stratum, but particularly difficult for those who are financially challenged. And also this question of segregation, that there are certain child care centers who, because of their price basically, though sometimes there are other factors at work as well, draw kids only from a certain socioeconomic stratum and not from others, and that's, many of us would believe, not good for our society in many ways, including creating some gaps that have been well talked about yesterday. The quality of child care does tend to be inconsistent, and again, not optimizing the approach to really stimulating kids. The childcare professional, this is the first thing I think that we're trying to do in Vermont that's maybe a little bit different, is to think about the childcare professional a little bit differently. And if you think about it, the childcare provider has certain assets going for her, and it almost always is a her in our society, occasionally a him, has certain assets that we don't take advantage of. First of all, they tend to be highly trusted by the family. The family's handing over to their care for hundreds of hours a year their most important possessions. So that there's clearly some level of trust there to begin with. And the child care professional, if you want to contrast it for we pediatricians, for instance, the child care provider is seeing that kid hundreds of days a year for thousands and thousands of hours, and in fact is seeing the family sometimes just fleetingly, but at least interacting with the parents on a daily basis throughout the year. So that's an interesting sort of set of credentials, of assets that perhaps we could be making better use of. So one thing that we're playing around with, trying to see is sort of pilot projects, whether we can do this around Vermont, is can we encourage and train the child care provider to be part of really the social safety net for families and children. After all, someone who is observing the kids on a daily basis, interacting with the parents on a daily basis, is in a good position, particularly somebody who actually has training in child development and other issues, to recognize a number of issues that are stressors in the home. Be they, as is a big problem in Vermont, I can tell you, opiate abuse in terms of the parents, be it underemployment, be it issues of domestic violence, inadequate housing, those kinds of things that the child care provider is often aware of or can easily become aware of. So are there ways we can train child care providers and use them, particularly in rural areas, such as Vermont happens to be, to really be that part of the social safety net that recognizes families in crisis and then can refer those families to various social service agencies and others in the community that can help the family deal with those issues. And then what about health? This is something that's gotten virtually no attention. Are there ways to use both the child care professional and the child care setting to do a lot more in terms of early childhood health and well-being than we've done? Clearly, in terms of developmental assessment, autism screening, things like that, these again are folks who tend to be trained in child development. Yet we don't use them very often anyway. There have been some attempts at this in a rigorous way to really do hardcore sort of data-driven, et cetera, deriving data about the children in terms of how they're doing. Speech and language screening. You can ask a child care provider without formal screening. They can tell you which kids have speech and language issues. But again, we could formalize that in terms of recognizing kids early, not waiting until they get to pre-K or too often to kindergarten or even later to recognize speech and language issues. And among the things we clearly have a large body of evidence about is that the earlier you recognize speech and language issues, the earlier you can deal with them. Nutrition, obesity, and exercise. If you have kids that are spending an average of 36 hours a week in a childcare setting, clearly they're getting a fair bit of nutrition in that setting. So are there ways we can increase the value of that nutrition? Are there ways that we can use that frequent experience, in fact, to educate kids and their parents about nutrition? And that's interesting in doing a number of ways, including the fact that if you really want to be data-driven, if you want to derive data, you have pretty easy short-term outcomes you can measure in terms of nutritional status of the kids to try various kinds of approaches to this to see which ones might work best. And obviously linked to that, issues of obesity, exercise within the child care setting, but again, creating a lifestyle for the kids, educating the children and the parents, not just about nutrition, but the value of exercise. Immunizations, I'm glad to say in Vermont we do pretty well with immunizations already, but there are some places, like California, that don't do as well with immunizations. And again, can you use the child care setting both to provide immunizations, but also perhaps, and I know the challenge to this, educating parents about the value of immunization. So that's another part, again, of the health kind of picture. Oral health. In the little state of Vermont, the state of Vermont itself spends $2 million a year on the in-hospital costs for kids with oral health problems. Basically rotted out teeth because no one has paid any attention to their oral health earlier in life. It's a big problem that I think we in pediatrics often tend to not pay enough attention to. But again, in the child care setting where kids are spending a lot of time, can we both pay attention to oral health status, again, find kids earlier who have problems with it, but particularly teach some things, both employ them and teach them to the kids and the parents through, again, this trusted person who is usually non-threatening to the parents, the parents see more as a peer than they tend to see their pediatrician, et cetera. Can we work on oral health in those settings as well? There's this, I think, very important, many of you saw back in January, call from the U.S. Preventative Services Task Force that we should be screening basically all adults for depression, but particularly women in the perinatal and postpartum periods. And there's been, I think, widespread support for that idea. What there hasn't been is any good identification of who in the world should be doing this screening. And part of it, should it be the obstetrician? Well, that's really not the focus of the obstetrician. How long after the pregnancy is the obstetrician going to see the mother? Should it be the pediatrician? Well, it's not the focus of the pediatrician, and the pediatrician may not see the woman at all before pregnancy, may not even know the woman, may not recognize the signs in the same way postpartum, and has some other things to worry about in the postpartum period, et cetera. Could this trained professional who sees the parents on a daily basis, et cetera, particularly if they have an older child that's already in the child care setting, could we try some pilots where we train child care providers to actually be screening, and perhaps both parents, but particularly new mothers, in terms of depression, again, being able to recognize and refer to appropriate folks in the community to help the family deal with those issues. And I hope, you can come up with a longer list of ways that, again, we could use the child care setting to try to do some of those, particularly screening, but other kinds of health education, health interventions kind of thing, that from a public health sense make a lot of sense but because of the periodicity of visits to the pediatrician's office and or the busyness of those visits, really can't get attended to. One of the things we're looking at in Vermont, particularly, and we think that might work particularly in other rural areas, is that in Vermont, almost everyone lives in a small town. We do have a big city. It's called Burlington. The biggest city in Vermont has a huge whopping population of 40,000 people. So we tend to think of Burlington as the big city with all the problems, and et cetera, et cetera. But for the rest of Vermont, people live in small towns. And there tend to be, one or two pediatric or family practices that see all the kids in the town, and a limited number of childcare providers. So one of the things that we're beginning to do is seeing how we might link them more closely together so that they can deal with common issues together, help each other with some of the really shared agenda that they have. So we're beginning to work on this in Vermont. You heard that I'm working with an organization called the Permanent Fund for Vermont's Children, which is sort of spearheaded this effort, but working with lots of different parts of the state, both in terms of the Department of Health and other state agencies, the Department of Education, other NGOs, individuals around the state, et cetera, to see if we can't really create some pilot studies in selected areas of the state to try some of these kinds of ideas out and to rigorously measure what's happening, both in terms of what are the interventions and what are the outcomes, to see if we create some models that, again, might be particularly useful, not only we hope to the state of Vermont, but other rural areas of the country particularly, where a lot of health issues, as you've heard yesterday, tend to be exacerbated. So I think we're doing some interesting kinds of things there. We're also working with hospitals, ACOs, and others to see in terms of, you may have heard that Vermont's doing some interesting things in terms of healthcare financing. It's been out in front of the rest of the country a little bit on that. And thinking, are there ways, in fact, some of the revenue stream that's been used for more traditional healthcare provision, is it conceivable? We don't know if this actually even makes sense yet, but at least to look for models of this, had some of those that funding stream, if you can show that childcare actually has the kind of impact not just on child health, but long-term health. If we can show what we all know somewhat of, you saw Jim Heckman's curve yesterday, et cetera, that for a state or any other group that's interested in public policy and interested, amongst other things, not just in well-being, but economic impact, if you can show that the kinds of things that Jim Heckman has shown occur by doing really good job with early childhood, have a lifelong impact on healthcare costs, beyond even what Jim Heckman has shown, but also things like incarceration rates, employability, et cetera, finishing of high school, those kinds of things. We think we can make perhaps a winning argument for the idea that for a state that really wants to look at healthcare as a kind of holistic concept and wants to look at it in terms of long-term outcomes, not just short-term ones, and long-term benefits, that you might even be able to make an argument, because obviously a fundamental issue with childcare is how do you pay for it? If accessibility is an issue, if affordability is an issue, but so is the issue of retaining skilled childcare providers, and that is often an economic one, then clearly we need to think, are there other creative ways to bring some more finances into the system? Now, a lot of Scandinavian countries, et cetera, have done the interesting thing of simply saying, children are important. As a society, we're going to invest in them. So we're hoping that there's at least somewhat of a movement in this country to be thinking about that. And exactly how I know that David Alexander and others here have been thinking a lot about this. How do we sort of create a climate of taking children as more of a priority for our country? But is this one of the ways that we might do that? I think we need creative approaches to this. Again, my basic argument to you is that childcare has been out there. We've thought of it as largely a custodial situation. Our dream for childcare would simply be that my kid comes back to me at the end of the day no worse than when I sent the kid off. Now, in fact, a lot of childcare providers doing a much better job than that. But I think we as a society and we as folks who care about kids' development, be it cognitive, emotional, social, and care about kids' health, owe it to ourselves and clearly to the kids to think about, could we expand the use of this place where kids are for a long period of time, and again, the particular sort of assets of the child care provider being trusted by the parents, the regular contact, et cetera. So can we think creatively? Are there other ways of doing this that might work much better here than would in Vermont, et cetera, et cetera? What I really want to do is to challenge all of you to think about this. I'd be happy to talk with you whenever or wherever about this kind of push to do this. But that's what I really want to introduce to you. No data, except for maybe the contextual data just to prove that that's where the kids are. But to have you think more about, are there ways to do this? I think that as you're thinking about that, we want to think at the same time, how do we do this in a way that we actually get good data? Because like all other things we try, there are lots of things that make common sense that probably look good, but don't achieve the ends we would desire. So as you're thinking about this, don't just think creatively about how you might do this in your community, in your region or whatever, but how would you measure what you're doing and what are the outcomes you would want to measure them? How would you measure them? So gradually we can build some real expertise about this and know what works for what kids and what families and what situations, because that's really where we want to get to. Now, I've purposely tried to make my talk shorter than Gary said I had, so that I'd be interested in any questions you have, but I'd also be interested just in any thoughts you have, anything about, well, gee, that's not going to work because of this, or where I happen to live, or here in Palo Alto, whatever, we've already done this and I just haven't heard of it, or, gee, maybe if you did this instead, or maybe we should try this. So with that, I'll finish, and I think we've got time for any questions or thoughts that you might have now, or again, I'd be happy to talk with anyone later about it.
Great, Alan. Thank you very much. I think this is very provocative, and I love the way you framed it at the very beginning, that we're talking a lot about what goes on in terms of parental care. We're talking a lot about early education, pushing more globally towards pre-primary education, the importance even before age 3 of getting that kind of cognitive stimulation. But this untapped resource that you've been describing, I think there's tremendous opportunity there, and you don't hear many people talking about it. So it looks like we have some questions here.
I was a little bit aware of that Pittsburgh experience, but not to that detail. It's very helpful to hear about those. There was that really did, I don't want to make this sound as though it only did, because what it did was really important. It was completely really about, using the term loosely, child development. It didn't look at what we think about separately too often as sort of child health things. Is that correct, or did it incorporate any of that? Yeah, which is, if we could child development well, that would be good enough, but yeah. Yeah, that one I did not know about at all, Lee, thanks. And I think part of what, I'd be curious about both of them in terms of sustainability, because obviously what we'd like to create is a system which is so effective that A, it really benefits kids, but B, it convinces policymakers that they want to invest in it. So the Permanent Fund is this wonderful group that has raised $20 million to do this in Vermont over the next 9 years. But there needs to be some more permanent kind of sustainability. So you need to do it in a way that really demonstrates to folks the social good that's accruing, and that's doing it in a cost-effective kind of way. Yeah.
We have a question. Okay, it's hard to see. Thank you.
I think the 11 million figure does not refer only to accredited. And of course, accreditation varies by state, et cetera, exactly how that's done. But that includes, I think, a lot of informal child care arrangements.
Some of the challenges that I would foresee as a great model would be that a lot of the providers aren't those child professionals, but they're a friend of the family or a grandparent who don't, and also may have the same exact challenges that you're trying to identify.
Sure, and that is part of it. It's a good point, which I didn't talk about enough, is the variation in childcare provider setting, let's say, is I think all of you know, if you think about it for a second, just incredible. And it varies from the grandparent who's looking after the kid to the incredibly well-staffed, university-based center with a wonderful ratio of staff to child, et cetera, et cetera. So it varies incredibly in our country. And again, there tends to be some economic segregation in how this works its way out. One would hope to be able to do this across all of those different platforms. Admittedly, it's going to be easier to do in the more organized, more formal centers that which often means accredited, et cetera. So you can break this down in various ways exactly. There are millions of kids in each of those different kinds of settings.
I'd like to ask you a question as the moderator prerogative. That there is some recent very interesting data that came out from McKinsey Global suggesting that if men and women had equal opportunity in the workplace, we could add $28 trillion to the global economy. That certainly requires a functioning child care system. But yet when you look at policy around the world, the US is one of the least committal countries when it comes to policies that would support the kinds of initiatives that you're proposing. You lived in Washington a long time. What do you think about that?
My first immediate thought is, I'm so glad I'm not a federal employee. I don't have to think about how I answer the question. Yeah, I totally agree with you. And this gets to this larger thing about how do we prioritize kids' lives. And the wonderful thing to me about prioritizing kids' lives, now that I don't work as a Fed, I can say this, is it also tends exactly to work in the same direction as social justice and vice versa. So I think if you create communities, countries, others in which social justice is prioritized, kids' lives tend to be, and vice versa. So to me, it's a wonderful thing that they really work hand in glove, I think. And clearly, the idea of having visitation in the homes, of having paid for guaranteed parental leave at the time of birth, all of those things work towards achieving these ends, I think.
Great. Well, Ellen, thank you very much. Really appreciate your thoughtful words.